hello, everyone, and thank you for joining us this evening. Um, it's Black History Month, and I see a lot of people posting, and I think that's fantastic that people are recognizing it. Don't see as many as I usually do, but
Yeah.
it's the time. Um, but the thing that we wanted to do, and Jack isn't on the screen, but he's here with us. Jack Caudell is with Wellbeing Connection on the board with me, and he reached out to me, and he said, we need to do something special for Black History Month, and we don't want to
Hmm.
just post. I'm thinking we really need to do something about mental health, and I was all over it, and I was really appreciative of him being thoughtful, because in our community we don't spend enough time, we don't
Yeah.
talk about it.
Hmm.
If you do, and it's gotten a little better, but if you do talk about it, it's taboo, as in
Hmm.
many subjects in our community. And so
Yeah.
to be here with you, Alice, and for any of you watching, if you don't know, Alice Mills Mai is the clinical director, and she has a lot of letters after her name. I don't know what they are, and she's not helping me because she just puts Alice. But she has lots of degrees, and she's the clinical director of Ellie Mental Health in Columbus. I met Alice. It's been over a year, but I met. Yep, it was over a
Yeah.
year ago. I met Alice because we got the wonderful opportunity, or I thought it was an incredible opportunity to work together on pathways to resilience with the WALK Retail Alliance.
Hmm.
That program was amazing, and we have to figure out when we bring that back,
Yes.
so more people can benefit from it. But just the understanding of how mental health plays in our well-being, and
Hmm.
understanding that it's not something to be ashamed of. It's
Hmm.
not something to it's not a taboo.
Yeah.
It's a part. Your everything is connected. And if
Hmm.
you go to the doctor, if you have the flu, then you should also take the same care if you're not feeling like yourself,
Yeah.
or you know and if others recognize that, then that's what being ally and a friend,
Hmm.
and someone you love. So I'm going to start asking you some questions, Alice, because I'm looking forward to this conversation. Okay.
Okay.
We're,
Okay.
Let me just tell you, everyone who's watching, we are going to cover so many
Yes.
subjects
Yes.
tonight. So please take notes, and you can reach out to Alice on where. How would you like people to reach you?
Um,
LinkedIn.
LinkedIn. Yes, LinkedIn would be good. Yeah.
Okay.
Yeah. Hmm.
uh, on LinkedIn, and again, we'll let you know how to contact
Yes.
Alice,
Hmm.
or reach out to Ellie Mental Health.
Hmm. Yeah.
So let's start with, as we were talking, the taboo, the stigma, cultural perceptions.
Hmm.
So how can we reframe strength,
Yes.
right, in
Yeah.
Black communities to
Yeah.
include emotional vulnerability, but
Yeah.
not perpetuating harmful stereotypes? Because the strong Black woman. Like, I was
Woman.
raised in that house, and it took
Hmm.
many years. I think I didn't crack that spell until maybe 8, 10 years ago.
Wow.
The
Yeah.
idea of being strong,
Hmm.
being just taking everything, and
Yeah.
not taking care of yourself. So
Yeah.
how can we reframe that?
Yeah. So I think the idea of strength, usually when we think about it, is physical. So being physically strong, that means that you can withstand everything that comes your way. And then when we throw in the word resilience, that can also be difficult, like the paradox of being resilient and the paradox of being strong as well. And usually also resilience usually is come with Black youth, where they are often told, oh, you're so resilient. So look at maybe what's going on in your community, and yet you are showing up at school and you're doing well and you're so resilient. And so when we talk about that kind of strength, it often means that Black people are not getting the help that they need, both themselves recognizing that they need help, and other people, the external people, institutions, schools, workplaces, and all of those things, they also do not recognize that Black people need help because you are strong. So if, let's say, at the workplace, if there is an employee that I have to check in on, I'm not going to check in on you because you're always showing up. When I ask you how you are doing, you're always saying, I'm doing well. You are overperforming at work. So
Mhm.
you don't need any check-in, you don't need support. It's usually the person who maybe is not getting their work done. They are the one that gets the check-in.
That's right. That's right. No,
Yeah.
it's true. It's true.
Yeah. So because there is also, we have the pressure to perform. So sometimes we also feel like I cannot say that I'm struggling. Then maybe I'm also falling into another stereotype of being lazy, of not wanting to work. So there are so many layers to it that I think to reframe strength, we also have to find our community of people. We
Mhm.
have to find those intimate spaces and to know that strength is also asking for help. Strength is also telling somebody, hey, I am not doing my best today. Oh, I need to talk to you. So, strength is not only physical, but it's also emotional strength as well. And being emotionally strong is also recognizing when you need help and when you need support and when to get that support. And there are times that we also have to push back when people call you the strong friend, the strong Black woman. You have to push back, like, hey, I am not. I am very fragile. I want to be handled with care. I am very delicate. I break. And that's how I want you to see me. And that's how I want you to handle me. So there are really layers to it in that way.
All very true things. And so many times I've heard it, um, and it wasn't until, I guess I felt like if you can't handle everything, then there's something wrong with you,
Yes.
which is unfortunate. But
Mhm.
I think there's also the idea of, God, right? And
Mhm.
so many times in the Black community, it's like go to Jesus, pray on it. If you're not
Mhm.
praying hard enough, because if you were praying on it and you were close enough to God, you'd
Yeah.
have a solution. And so
Yes.
when you think about that and you understand, I guess, the history of Black people not having
Mhm.
anyone on their side, the only
Mhm.
person
Mhm.
they had was God, right?
Mhm.
And
Mhm.
continuing that.
Yeah.
What role can faith communities play in destigmatizing this,
Yeah.
right?
Yeah.
Because I think we've progressed quite a bit, but I think there are still those
Yes.
institutions that will say, "Well, you just need Jesus. Come talk to the
Yeah.
priest."
Mhm.
So how can faith communities work with mental health organizations or
Mhm.
practitioners to destigmatize mental health care?
Yeah. One thing that I always tell people, that even in the Bible, there is a passage that said, and Jesus wept, that even Jesus showed emotions in some way. And even the time that he was grieving Lazarus and all of those things, he showed some kind of emotion. So oftentimes when I'm talking to people, specifically with Christian faith, because that's what I grew up with, the first thing I tell them is that, listen, we serve a God of emotions. If there are no reason for our emotions, God wouldn't create us to have these emotions. And so there are reasons, and our emotions serve a purpose. And with faith communities, I think first of all is faith leaders accepting some kind of training, mental health training for themselves, just to know the basics, to know that if you are in a congregation or a church with somebody, or the mosque, or whatever faith community that you belong to, it is important for the faith leaders to get the education to be able to recognize, okay, usually I am the first point of contact that maybe somebody will come to me. So if somebody is coming to me and maybe they are expressing symptoms of depression, I don't have to tell them to go and fast. I don't have to tell them to go and pray more. Because again, if you're telling somebody to go and fast, we have depression with psychotic features. And when you are hungry and you are not sleeping, then you are
Yeah,
yeah, then you are making it worse. So if a
right.
person is in depression, that is not the time maybe for you to tell them to isolate themselves, to go and pray. Because again, they are already feeling worthless about themselves. So you telling them to pray and pray, then they are going to internalize it that if I am not getting better, then it means that I am doing something wrong or I am not praying.
Wow.
So
Yeah.
giving them that kind of education to know that, okay, when you hear these words, when you hear hopelessness, when you hear helplessness, maybe it's time to, push or direct them to a mental health professional. Let them to a psychiatrist. Let them seek the help while you are also praying with them or whatever you are doing with them. But there are times that these practices that we would say, oh, it connects us to God, it can actually be detrimental to people. So also knowing when you tell your congregation you have to fast, you have to do this, that sometimes you have to say, okay, maybe we are fasting, but if you know you struggle with anxiety, or if you know you struggle with depression, or if you have any kind of mental health disorder, schizophrenia, psychosis, maybe this is not a time. This fast is not for you to fast. Come, let us talk about this. Let's
Right.
talk how we can find ways for you to connect, but please do not do this. Yeah.
Yeah, I mean, I didn't even think about that, but I think that that's a really important point, and I think it goes back to self-protecting, right?
Hmm.
Not
Hmm.
having those conversations if
Yeah.
people don't know what's going on in your life.
Hmm. Yeah.
And so, and it's vulnerability, and vulnerability, is like one of the hardest things. So hard to be vulnerable.
Yeah.
There's so much strength in being vulnerable because,
Hmm.
it's hard. And if
Hmm.
you can overcome that and ask
Hmm.
questions and tell people where you are, I think that's the key.
Yeah.
But then when you think about the and there's so many different dynamics to the Black community. I don't want anyone to think that this is just one.
Hmm.
There are some of the commonalities, right?
Yeah.
And some of the other things that the Black community deals with are structural barriers or
Yes.
access, right?
Hmm.
Access to real care.
Yeah.
And so, what policy changes? Because there's a whole lot going on right
There
now.
is.
Uh, but if you think about that, what
Hmm.
policy changes could most effectively expand insurance coverage, right? And so many communities don't even have insurance, and even if they
Insurance.
have the affordable care,
Hmm.
some of that insurance, depending on what you can afford, it just doesn't cover. And a lot of are still, limited in mental health services in
Hmm.
underserved Black
Yeah.
neighborhoods, right?
Yeah.
So in neighborhoods where they don't have these resources, what policy changes would you want to see?
Yeah, so in those neighborhoods, I would like to see making insurance easy for people to get access to insurance because sometimes there is an income limit to insurance,
Yeah,
and there are people who are actually making way less. But when it comes to the government or the state that they are in, they are seen as though you're making too much money to
I
get.
know, crazy, but it's still it's like just above poverty, and we
Exactly.
know like eggs
Hmm.
cost $5, almost an egg, right? So yeah, it's
Yeah.
ridiculous.
Yeah.
What about clinics? Do you trust clinics? Do you think they're good, or do you think what do you think?
I think clinics serve a purpose in some way. And also, me being a therapist or being at the other end of it, I also understand why some clinics will say, I'm not going to take insurance
Hmm.
because it's a hustle for clinics to go through. They
Oh,
really make it difficult to get credentialed when you are submitting claims. Insurance companies want to do everything but pay you. They don't.
oh, that's so unfortunate.
Yeah, so they really make it difficult. So then if let's say there is a clinic that's not big as Ellie or doesn't have like a big corporate supporting them, and it's maybe a few clinicians who have come together, they don't have that they don't have the infrastructure to deal with insurance, to submit claims, to stay on the phone with insurance companies. So they would just say, I'm going to do only private pay. And then that also means that people have
That
to decide.
includes people, right?
Yes, it excludes people. Then people have to decide, do I buy food or do I take care of my mental health? So when we talk about policies, there are so many things that need to change. And then when we talk about education, also being a therapist is expensive.
Yeah, I bet. I
Yeah,
know. You have to go to school for a long time.
long time.
Then you have to, don't you have to re-credit?
Yes. Every
Okay.
2 years, you have to make sure your license is active and you have to get continuing education. And we are working in behavior science. So that means that things are changing. The research is coming out new all the time. So there are new interventions coming out, new research. So if you want to keep up with it, it's really expensive. So that also means that, and then the pay is not that great.
I think, but in every Hollywood movie, the psychologist or well, they're
Yeah.
changed, and they always have a fabulous office either in
I,
LA or New York City in a
yeah.
brownstone. I'm like, who's
Yeah.
supporting
No,
that? Like, that's
no,
amazing.
no, that is
People
not.
who don't take insurance, therefore.
Yes, yeah. If you don't take insurance and if you work with celebrities, you can charge $1,000 per session and then go away. But yeah, but for the ordinary therapist, it's really expensive. So at the moment, even the field of therapy is facing crisis where um, we don't have therapists. There are long wait lists. Some people may get the degree and then they will go into another field because if they look at what they are going to get in a clinic, and if a tech company is offering them some huge amounts,
The organizational development, or
yeah, they will rather go there then. So there are so in terms of policy and structural changes, there are so many things at all these different levels that need to change, not only for the client, but also for the professionals who are doing the work. And especially if we want to attract Black mental health professionals, because when we talk about wealth as well, a lot of Black professionals do not have generational wealth to say, oh, I have a trust fund, so I'm just going to go into the field and do whatever I want. But because if you're a first generation college student, that means that you are also taking care of your family or you have other responsibilities. And so what the compensation doesn't seem attractive to you. So there are also those other things where you have to go to school, student loans, and when you get into the field, gatekeeping. There are so many things that it really
you have to really want it. You want
you have
to
to really,
make a
yes,
difference. And
yes.
and there has to be something else, sounds like other levels of support
Mm-hmm.
to
Mm-hmm.
make sure that you can survive, because
Exactly.
you're dealing with other people's mental health. You have
Exactly.
to take care of your own, and you have
Mhm.
to be able to live, right?
Yes. Yes.
I think that's big,
Yeah.
and but the flip side of that is that we need more.
We need, yes.
We absolutely need more,
Yeah.
because we need more culturally competent providers,
Mm-hmm. Mm-hmm.
right? And when you think about in underserved communities who don't have access, who don't have systems to show them what mental health could mean to their just successful living, right?
Exactly.
And there aren't resources, then when there are crises, they call the police.
Yes.
And depending on where you are and how well the police are trained,
Mm-hmm.
then we have these issues that we see too many times.
Yes.
And
Yeah.
so, what emergency to preventive care
Mm-hmm.
models have you seen that you think are working, that other people can look to?
Yeah.
Because it's important. And I know there are communities that have, what is it? It's not, you don't call 911, you don't call for what?
Yeah. They have a crisis line
Yeah,
that,
I
yeah.
forget the number.
Yeah.
We'll post it when we post the video.
Mm-hmm.
But yeah, there are crisis lines in
Mm-hmm.
certain communities that go directly to mental health,
Yes. Or
right?
somebody trained. So I think one of the things that I've seen, mental health first aid. Um, there are organizations that train people, just basic mental health first aid. This is how you could identify if somebody is in crisis. This is how you could practice active listening skills. This is how you can connect somebody to resources.
Mm-hmm.
So also peer counseling in communities where there are no counselors or there are no clinics. Peer counseling can be great, and these are people who do not have to go through the long education, but they can just get the basic information and the basic training to support people in their community, to hold maybe a support group for people. And also support groups are also important. So again, in communities that there are no resources, and when you think about it, for Black people, we are very communal, right? We thrive in community. So those kind of community events can be really helpful, where sometimes you don't have to put the name mental health on it. Sometimes you come and you can say, oh, this is a lunch event, or this is a breakfast event. And you know, when people are eating, they get comfortable and they could start talking to each other. Okay, this is what's going on. Oh, maybe I spoke to somebody about it. Oh, maybe I read something about depression. It looks like that's what you're going through. So the part of it is also sometimes we don't have to put the name mental health on things. We can call it, now people do wellness lunch.
Yeah.
Yeah.
Yeah. I mean, we do it with other things, right? Like I guess this is saying how old I am, but I get invited every other week to a dinner, a free dinner that, on the front, it's like, oh, come and join us for a community conversation. And then on the back at the bottom, it's like, it's a retirement dinner. Like, we're going to talk to you about retirement. Like, okay, that's just a way of saying old.
Yeah.
And then, or with women's groups now, there are a lot that talk about menopause and other issues, and they're all life issues.
Yes.
Right? So
Yes.
if we normalize it and make it part of the dialogue, we could help more people.
Yeah.
Because they feel more comfortable.
Yeah.
And I just want to say, for anyone who's on LinkedIn, no, not on LinkedIn, because Chris and Mallory are on LinkedIn, but on Facebook or Instagram or YouTube, the crisis line number is 988. Thank you, Chris. So it's 988 for a crisis. You might want to write that down where you have 911 or any of your other emergency numbers. It's 988, and that is for suicide as well as for mental health crisis. So let's jump into it's Black History Month. Well, let's talk about some historical trauma.
Yes.
And so, in what ways does the legacy of medical exploitation and this, I had to, it's like Tuskegee and, of course, I can't think of her name. I can't think. Lax, right? And the cells. How does it still manifest in mental health care interactions today? And just to put it out there, that the person who was recently nominated to be the head of health, and said that Black people don't need vaccinations at the same rate as others because we have stronger immune systems. That is not true. That is not medically proven. And so mental health is the same thing. It's the same thing. So how do we overcome that legacy when we still have people perpetrating fraud and bad information? How do we? It's just dangerous, and it prevents too many people from pursuing mental health. How do we overcome that?
Yeah, so you mentioned those two examples, and then even within the psychology field, there is history of things in there where enslaved people who were running away was seen as a mental health disorder or psychological disorder.
Wow.
So even within the psychology field, it has its own history with with enslavement with Black people. So it really makes it difficult for people to seek help. And then when we talk about the practices that we use in mental health, practices that are of, let's say, Black people, Indigenous people, often they are not respected
Mm.
until a white person takes it and then calls it evidence based, and then all of a sudden,
Wow.
all of a sudden, it becomes this revolutionary thing where there could be Black people sitting back like, this is we do this all the time. What do you mean that this is all of a sudden evidence based, or this person has discovered this? You didn't discover it. You just it's been there. So it
Just put
makes
the seal of.
yeah.
Mhm.
Yeah, and then you get funding, they will get funding to fund the research and all. So it makes it also difficult for Black people to see themselves in mental health, to see that Black healing practices is also evidence-based, is also legit, is also credible in a way that oftentimes I ask people, what are the traditions in your family? What
Mm.
would you celebrate in your family, and then incorporating that into therapy. And
Oh,
if let's say therapists really focus on, let's say I'm only going to do CBT, it's really going to be harmful to people, because CBT, it's about changing your thoughts. So if a person is saying, I'm struggling with racism, I'm not going to tell you to change your
the
thoughts.
thought. Right. Right.
Yeah, that's like putting the blame on the person when the
Yeah.
blame doesn't belong to them. So that also makes it difficult for people to go to therapy in a way where they will say, oh, I'm not going to go to therapy for you to tell me positive thoughts or change your thoughts, and then things are going to work out when I'm facing real issues. When, if let's say the person that I go to isn't going to validate my experience as a Black person navigating the world, isn't going to validate my experience of being distrustful of a therapist sitting across a room from me, and they are not going to recognize that, yes, psychology as a field, psychotherapy as a field, it's not a perfect field. It has its own flaws, and we are working on it. However, that doesn't also mean that you shouldn't seek help. So meeting people where they are, sometimes I think that helps. Where are you now? How can we meet together? Because if you're struggling and there is help out there, especially if you're struggling and you work in a company that they give you insurance, that you can use your insurance for mental health care, you should use it. There is a way maybe to go about it gently. That's oftentimes I try to tell people, just try it. Try it
Yeah.
and try it and see.
I do think, the idea of being distrustful, if it's
Mhm.
my employer, now do they know that I need mental
Okay.
health treatment?
Yeah.
How's that going to affect my job? How is that going to affect how I'm
Yeah.
making a living? I don't know. I don't know the answer to that, but I know
Mhm.
there's all the oaths that have to be taken. But
Mhm.
if
Mhm.
people don't, I mean, I understand the idea. How how about schools? I mean, how
Mhm.
can schools do a better job in those communities? Because some of the issues that the young people have to deal with in underserved communities, and not
Mhm.
all Black, and let me just be clear, not all Black communities are underserved communities.
Yes.
I'm talking specifically about underserved
Okay.
communities right now.
Mhm.
We'll talk about other communities, but
Mhm.
how can schools better address students
Mhm.
who are coming from an environment that doesn't have access and they don't know?
Yeah. I think something that I know some of the schools have started doing is they've started doing assessment,
Oh, okay.
like depression assessment or anxiety assessment, just to get the baseline of some of them. So some schools have started doing that for the children, and also if they kind of recognize something, they have to then maybe talk to the parents. And also with Ohio, right, there is a new law that went in place that
Yeah.
is going to make it very difficult for schools to even deal with some of these things, because parents have to be involved in everything. So that can also make it difficult for some of the things that they may want to implement in schools. But I know, especially with all the tragedy that happens in schools. Schools are really trying to beef up their conversations, their education around mental health. I would love it if there could be a class, a curriculum for just basic mental health for even first graders to get, okay, this is what anxiety feels like. Anxiety, it's normal. Sometimes you have a test.
Yeah.
You can be anxious, and that's okay. This is how you can deal with it. Maybe breathing exercises, going for a walk, or talking to somebody about it. That can really help if children are getting it at that stage.
Mm,
Because for a lot of adults, some of the issues that we are facing is because we were not able to get those skills
that's true.
very early on to deal with it, to know that, okay, if I am anxious, it doesn't mean I am a bad person. It doesn't mean there is something wrong with me. It doesn't mean that I should work hard. I should go and work hard. It means I'm not. So that can really help. But I know schools are really trying to stay on top on, autism diagnosis, autism evaluation, ADHD evaluation. They are really trying, at least in the school district that the clinic that we have in the school district. I see that the schools are trying. Yeah.
Yeah. I mean, it's not easy.
Hmm.
Even harder depending on where you come from and what your beliefs are and what the
Yeah.
community, does. So if we talk about representation, right? Because we know representation matters.
Hmm.
More comfortable with someone who you feel has a shared experience in life with you. So what um, and we also know that there are fewer Black therapists. So what training should non-Black therapists go through for that cultural competency? Because just because there aren't Black therapists doesn't mean that Black people shouldn't get therapy.
Hmm.
And
Yeah.
so what should they do?
Hmm.
How can, what can they do so that these potential patients of theirs get to know them? And is it patients?
Clients. Some people say patient, some people say client. It just depends on, yeah. I know a lot of education includes what is called multicultural counseling or multicultural psychology and those things, but those are one-off classes. So
Oh, okay. It's like DEI training in
yeah,
corporate America. They give you one class and say, okay, you're good.
yeah.
Yeah,
But
no.
if you're really dedicated, I know some non-Black therapists who are really dedicated, that they make it their lifelong mission to get the education outside of the classroom. So that's also important, that it's not just, I think sometimes when people think about cultural competency, they only think, oh, I go to the class, I get the certificate, and then I'm done with it. Then I check a box, I'm
Mhm.
culturally competent. But
Yeah.
that's not, it's a lifelong process that all therapists, even me as a Black therapist, always learning about, disabled people, Black disabled people, because there are so many differences within us that it's difficult just to say, oh, I'm a Black therapist, so I get you. No, I don't. Our
Yeah.
experiences
Yeah.
are so different. And so that education should be a lifelong education, and it should be also be a lifelong commitment as well. And then just to learn, I think that's also important, that sometimes clients feel like, I don't want to use my therapy session to teach you
Mm,
about what it means to be
mhm.
a
Right.
Black person in
Right.
America, about Black history, about Black culture. It's my therapy session, it's not your education
I
session.
get
So I don't want to use my time that whatever I say, then I have to pause and explain it to you. This is what this means. Then it really disrupts the relationship. So it's really up to the therapist to continue learning and to continue to be curious about Black folks, Black history, Black healing. I always say Black healing practices that even if your school didn't teach you, you have to go out of your way to learn that and to incorporate that in your work with clients.
Yeah, I think it's you make me think of just in work and how there's so many different. I've heard so many times, oh, I didn't even think that I had to approach different people in different ways. And the world is very different. And if we
Mhm.
don't meet people where they are or
Mhm.
understand those nuances, then it often becomes like a very toxic or volatile
Yeah.
situation.
Mhm.
People don't feel like they're being heard.
Mhm.
And so I can imagine that in that situation, if every time you want to talk about what's happening, you have to explain a situation, you can't possibly feel like you're being heard.
Mhm.
Right.
Mhm.
Yeah.
Yeah.
That's
Yeah.
interesting. Um, so let's move on. Yeah, we've been talking for 35 minutes. Let's move on to community solutions um,
Okay.
and advocacy. So,
Mhm.
what grassroots organizations are successfully bridging gaps in mental health literacy?
Hmm. I know there is an organization in Chicago, Sister Afaya.
Sister,
Um,
okay,
yeah, they do mental health first aid. It's a Black woman-owned practice. They sometimes provide free therapy sessions, sometimes 5 sessions, or whatever duration that you have. Sometimes they provide sliding scale based on your income. So they are really doing that. And then there is Beam, BEAM.
okay,
.org is also an organization by a Black individual. They provide so many, they do trainings for folks that maybe want to learn. They do pop up events. So, like I was saying, sometimes the events have to be fun. So, like, they cater to millennials, who want to do brunch, who want to hang out, who want to do social media stuff. So you go to a mental health event, but you'll be taking pictures.
oh, okay, okay,
So they make it really fun in that way, but it's also serious conversations
yeah,
that they are having in that aspect. And then I know there are also groups that happen that are not very, like, they are not known, or they are sometimes they are not even registered, but people having conversations in their kitchen at their dining table, people having monthly check-in with each other, that okay, this month we are going to check in with each other. How are you doing? What is going on? How can we support you? Those kind of things. So there are things going on, and I think we all can also take some kind of initiative. And I also don't, because I know Black women, we take things on. So I want to say this with, with an asterisk, like you don't have to be the strong person, or you don't have to be the friend that is always putting things together. However, it's also important that you create that group where you can be vulnerable, a group where you can lay your head down. Because also, I think part of the thing, especially in community, some of the research is showing that actually when Black women get together, we become really competitive.
really.
Yeah.
See, I
It's
don't
like,
think with my friends, but we also choose the friends we're with. And
yes.
right. And so I think that that's really interesting. So
Hmm.
one-upmanship, like, oh,
Yes.
you
That we
have it
want to perform
hard,
the
tell you,
strength.
ah,
We
okay.
we like, I am strong, I can do this. Like, so it becomes hard. So just, a note to people out there to be cautious of your friendships. Is it that kind of friendship where you want to be the strong one, or you want to perform for your fellow Black woman because you are like, oh, they have it all put together. So let me also try and be all put together
You
as
know,
well.
that's so interesting. But when you think about it, I hear what you're saying.
Hmm.
If you are considered the strong one, or she's busy,
Hmm.
then you're often alone because
Hmm.
instead of just reaching out and saying, how you doing? The assumption is you're too busy,
Yes.
right?
Yes. Yeah.
Which that I get that a lot. Like I'll
Okay.
see people doing things and I'm at home and they're like, oh, well, I didn't reach out to you because I see what you're doing on Facebook. And I'm like, you don't see me on Facebook, but you see me on social media. And
Yeah.
if it's LinkedIn, yeah, I'm posting it out there because I want exposure for
Mm.
WACRA. I want
Mhm.
that exposure. That's what LinkedIn's for. But I'm not there all the
Yeah.
time
In that moment.
posting what I did, but
Mhm.
I'm home. And
Mhm.
that can do a job, because the more that happens, then you're like, all right, well, I'm in this I'm doing this by myself.
Yes.
So I just have to be by myself and deal
Mhm.
with myself. And why do I
Mhm.
have to be the one who's always reaching out? And then it just becomes this whole cycle.
Yeah.
And we need friends, we need family, we need
Yes.
that connection.
Mhm.
You
Mhm.
know, and we're talking about this community that, I don't know, when I grew up, my family nobody lived more than 20 minutes away.
Mm.
And most lived like you could walk to their house.
Okay.
Yeah. Because they all live near my grandparents. So I go to
Okay.
my grandparents, I could walk right by.
Yeah.
And there was this feeling of I don't know, comfort in the family. But
Mhm.
I remember the story of my mother. For a couple of years, my mom couldn't walk because she was attacked in the backyard by a man who had we would
Mm.
say mental illness now, but of course then they didn't tell anybody. He
Okay.
stayed in the house. She was a little girl. She was out playing. He started chasing her. She lost her footing and
Mhm.
fell on my uncle's bike spokes and severed,
Yeah.
and she couldn't walk for several years. They didn't think she'd ever walk again.
Mhm.
And, I'm hearing this story as, someone that's in
Mhm.
the 80s now. And I'm like, well, why didn't they put them away? Like, why didn't they, why didn't they? Why didn't they? Why didn't they?
Mhm.
And that's really where I learned a lot about just our communities
Yeah.
need to keep things
Mhm.
closer.
Yeah.
And I'm hoping it's, I don't know, so many things are coming to bear.
Mhm.
And we talk about intersectional things all the
Yeah.
time now.
Mhm.
It's not, and so I hope that we're doing
Yeah.
more in that space. But when we talk about, like, let's talk about intersectional experiences, right?
Mhm.
So how do mental health challenges differ for Black LGBTQ plus individuals compared to their heterosexual peers
Mhm.
and
Mhm.
compared to their non-Black?
Yeah. 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 Like you said, intersectionality. So when we include faith in it, because when it comes to talking about LGBTQIA folks, we cannot take faith out of it. Because so
Interesting.
usually it's the faith that is dictating for people, or that is what some families will use that, oh, because of our
Oh, as a tool for judgment.
yes,
Got it.
because of our religion. So in mental health, we look at a lot of homelessness. Among especially LGBTQIA folks, youth, especially youth in the Midwest. When I
Really?
was in New York, a lot of them were coming from the Midwest, from the South, to come to New York because New York had services with the New York Medicaid at the time. You could get gender affirming surgery.
I see.
You could get all of those things for yourself. So we saw a lot of them come in and they were facing homelessness. Suicidality is also high
So dangerous.
among LGBTQIA folks. And then we have to talk about trauma, PTSD, the trauma. Like you said, some Black families are very loving and very accepting and done. And then we are talking about the ones that are not. That makes it difficult for their youth. They really make it difficult for them since their childhood. So some folks would have to drop out of school if the school is not supportive
Mm,
of them. That means it is going to affect their education. And once something affects a person's education, it can affect the trajectory of their.
yes.
So
Yeah.
whether they're getting a job or whatever they may want to pursue in the future, it really cuts the opportunities for them. And so that means that they may also have to end up in poverty as well. So there are all of these issues that they are facing, and then it would affect their mental health, suicidality, depression, anxiety, PTSD. And then when we talk about, heterosexual relationships, it's kind of the norm. So just you talking about representation, just not having that representation, not having who you are, your relationship being modeled in your community, being praised in your community. That, often in Black families, people would say, "Oh, this person, Uncle so and so is living with your friend or is living with your roommate, and they've
Oh
lived
yeah,
with the roommate
perfect.
for a
Yeah,
long time. Like maybe
yeah,
you should get your own."
yeah.
But
That's strange, right?
yeah,
Yeah,
so families not even acknowledging their relationship or their partnership and calling them a roommate. And also that means that they cannot show their love in the open,
mhm,
sometimes making it difficult for them to adopt children if they want to be parents, making it difficult for, so there are so many things that really impact their mental health. And it's a conversation that is still happening. And although we've made some strides, it's one area that I feel like we are really lacking in terms of the support, just the community support, and even how we behave online. When you check online in the digital space, how
wow.
people behave towards Black LGBT folks, trans women, even when we talk about the experiences of Black women, the experiences of Black trans women is really worse.
Right.
How the violence against them, how people talk to them. It's so that's one area that it's really really appalling that we really have to. I don't know how long it's gonna take, but I think more conversations like this, supporting people's well-being, giving parents the tools to support their children. Really, also the church, our faith communities also have to be involved in a way that, how do you love your children? How do you still provide for your children, even if you feel like, okay, maybe what you're doing doesn't align with my religion, but you still have to be a parent. You still have to make sure that they are getting the support that they need in school, they are getting the healthcare. You still have to make sure that their basic needs are being met, and not just to throw out them out of the house, or just not caring about that
Yeah.
anymore.
I mean, I can't imagine not caring about my child. What I can imagine is being afraid for them, right?
Mm,
And
hmm.
the way culture, I mean, think about what's happening now. It is
Yeah,
despicable. It is
yeah,
despicable.
yeah.
And yet it was voted in, right? But it's terrible that you can just
Yeah.
with your words
Mhm.
just
Yeah.
basically say someone is no longer,
Yeah.
right?
Mhm. Yeah.
And when you think about what the consequences of that are, and with the back, I mean, I don't know, that could be a whole nother conversation that we talk about. But
Yeah.
when you think about that, and as a parent, I can't imagine being a part of
Mm. Yeah.
whoever is turning my child away.
Yeah.
It's my child.
Mhm.
Once they get to a certain age, they have to make choices,
Yeah.
and LGBTQIA is not a mental illness.
Mhm. It's
It's
not. Yeah.
it's
Yeah.
not, and
Yeah.
it's unfortunate that as a result of treatment or non-treatment or anything, it could lead to a
Yes.
mental illness, right?
Yes.
Yeah,
Yes.
yeah. So we haven't talked about economics, right? We talked a little bit about served communities,
Mhm.
but in what ways does economic inequality
Mhm.
compound mental health
Mhm.
disparities in
Yes.
low income areas?
Yes. So just the economic in the world, we live in a capitalist world. So that means that having access or having even some say in things means you have to have some sort of economic power. in it. So that financial stress, that in of itself is stressful. Um, Poverty is a traumatic experience as well.
Yeah.
Activate a person's fight, flee, and free responses, where you are always in a survival state. If you are having to think about where is the next meal going to come from? How am I going to pay for rent? How am I going to pay for utilities? That means you are always in a crisis state. And the other thing is also, if a person's basic needs are not
Mhm.
met, we cannot ask them to be in therapy. That's right. We cannot ask them to be in therapy and talk about their feelings. I am hungry. I'm thinking about my rent. What do you mean I have to talk about my trauma? And I have to talk about my feelings? Like talking. So sometimes even going to therapy is seen as a luxury for people who have the money. Like, oh, this is a luxurious experience that you want to go partake in. I don't have that luxury to spend an hour on somebody's couch and then they will send me a bill as well, and then I'm hungry. I have to think about. So that in of itself makes it difficult for people, and then people get an insurance. So sometimes even if they qualify for Medicaid, there are a lot of places that do not take Medicaid. Medicaid is one of those insurances that people don't want to take because, again, the government makes it difficult for people to take Medicaid reimbursement, all these extra assessments that sometimes folks have to do. They're like, I don't want to do all of these. So that then also makes it difficult for people to get that or to get the support that they need. So just getting your basic needs met and having the finances, I think, is a very big deal for people. That um, if they haven't met, like when we look at Maslow's hierarchy of needs,
Yeah.
just that getting that basic, it is after our basic needs that we can even think about love and belonging. So if I'm hungry, nothing that you say makes sense to me. If I'm hungry and you're telling me, oh, go to therapy, what
Right.
therapeutic intervention is for hunger
Right.
than giving me the money that I need, or making sure that I have a job that pays me well to make sure my needs are met. So mental health, I think always I say it affects every aspect of our lives, every aspect. So the policies that we make, you getting a job that pays well, that is part of your mental health. That
Mhm.
checks off one stress out of the way for you, that now I have to think about stress. You being in a job that you feel safe, that you feel seen, that you feel belong to that job. That is also your mental health. You having a community, that's also your mental health. You living in a community where you feel safe, where you feel belong, you don't feel threatened, that's also mental health. You living in a country where you are not like how we are experiencing. It's like our fight or flight responses is activated every minute. So it's not safe for anyone, right? A lot of people are irritated. When you talk to people, they are irritated, they are frustrated, and that also disrupts relationship because I'm irritated by something, but it's not about you, but you are the person that's there, so you're gonna get it.
Yeah,
Like,
that's
why are
true.
you asking me all these questions? I don't know. So it impacts every aspect of our life, that we cannot say, oh, mental health is different. It's here. And then the rest of our life is here. No, it is together.
Yeah. I mean, that point is so important, and I think it's a great place to end our conversation. Mental health is everywhere.
Hmm.
And, you know, we just can't, we need each other more than ever.
Yes.
And if we can't afford a therapist, we need community, and
Hmm.
community needs to come together to
Hmm.
understand that humanity is like, I just, when I think about it, the whole idea of mental health, physical health,
Hmm.
and well-being,
Hmm.
it is the foundation for humanity.
Yeah.
And in order for us to feel that and to be whole, we need each other.
Mhm.
And yet there are some of us who have constant, to your point, constant people who, don't think it's they think it's a zero sum game, and
Mhm.
only certain groups can exist and others can't. And so
Yeah.
if you're dealing with something and you have to deal with that,
Yeah.
then that's where we are right now. And
Mhm.
so what was difficult in December is a great hurdle now.
No.
And
Yeah.
so if there are resources, if you don't have a psychologist, if you don't have a therapist, and if you don't have that in your community, learn how to talk to the people who live in your house, right?
Mhm. Mhm.
Learn how to talk to the people who are in your neighborhood,
Yes.
right? Be
Yeah.
discerning, but understand who you can trust.
Yeah. Take a
Uh,
walk around your neighborhood.
that's right. Take a
Yeah.
walk.
Yeah.
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 Let's leave it at that. Let's take a walk.
Yeah.
Take a walk, get to know your neighbors,
Mhm.
and just understand that life is hard and we need tools to make it easier. And we need tools to help each other. And
Yeah.
so I hope that as a result of this conversation, you've learned a little more about the hurdles, the access, what's available.
Mhm.
And number one, Alice is available. So Alice Mills Mai. So
Yes.
MAI. So
Mhm.
Alice Mills Mai.
Yes.
She is on LinkedIn.
Yes.
Ellie Mental Health is also on LinkedIn and
Yes.
Instagram. And
Mhm.
the New Albany Wellbeing Connection. If you live anywhere in Central Ohio and Columbus, New Albany Wellbeing Connection does an incredible job of bringing services and community
Mhm.
and fun. There are a lot of incredible opportunities to get to know new people while you're helping yourself. And
Mhm.
Albany Wellbeing Connection is also partnered with Ellie Mental Health in some programming. So we're building community, and we hope that you will too. But
Mhm.
check us out. New Albany Wellbeing Connection is on Instagram and Facebook. I think we're live right now. And we're going to replay this because there's a lot of great nuggets. Alice, thank you. Thank
Thank
you, as always.
thank you.
Wonderful talking to you.
Yeah.
And I hope everyone has a good evening. Thank you.
Thank you. Thank you. So